So this is video take 3. Let's hope it works this time. So I'm going to talk about central line associated bloodstream infections. So we all know what central lines are, and I'm sure many of you have cared for a patient that has had a central line. Central lines are used to give medication, nutrients, fluid, or blood, and they are definitely life-saving, but can also cause serious bloodstream infections, most often associated with insertion, maintenance, or removal. According to an article by the CDC, an estimated 250,000 central line infections occur in the U.S. In hospitals and care facilities each year. And of those, 30 to 62,000 people die from those infections. So the question is, what can we as nurses do to help prevent these infections? The key is education about insertion and removal, but also about maintaining the sterile state of the site. There have been numerous studies showing different ways to maintain patients free of infections from these lines. I'll talk about 3 different things I found to help reduce these infections. First is to have a standardized practice of care for all doctors, nurses, and any hospital staff that come in contact with the central lines. All hospital staff need to have the same training on the correct techniques to use when dealing with central lines. In many cases, patients will go home with the lines. So in this case, a large part of preventing these infections is teaching the patients these same standards of care that we at the hospital use. Second, site choice plays a large role in preventing these infections. It has been found that femoral and jugular sites have more harbor bacteria than the skin of the chest or arms. So they always try to choose the chest or arms, which is where I've most seen them. And third, based on information from the CDC, these are the correct steps in avoiding central line infections. You need to use maximal barrier precautions during insertion, including a full body drape on patients. Inserters should wear sterile gloves, a sterile gown, masks, and cap, and perform hand hygiene prior to the insertion procedure. You need to prepare the patient's skin with chlorhexidine, and again, avoid femoral line placement if possible. Do not routinely change catheters. And it says to consider using specialized IV teams for the care of the central lines. But I know on my floor, we as the nurses do the dressing changes and everything. So also use transparent dressing so that you can see the site. Remove the line as soon as possible after intended use. Change the needleless system device and end cap on a routine basis according to manufacturer's guidelines. And I know on my floor at my hospital we change it with every blood draw, so that can be almost daily. Let's see. Also, consider using a sutureless securement device. But I've mostly seen just the devices where they use the sutures. And adhere strictly to catheter care policies when accessing the line. So, in conclusion, assuring central line protocols are followed are essential in keeping our patients safe from these infections. We as nurses are the patient's advocate, of course, and play the largest role in preventing these infections. So when it comes down to it, the most important component in this prevention is education. Education for ourselves, doctors, families, and the patients themselves will help to end this problem that is completely avoidable. So I hope this video works this time, and I hope I did okay. So I hope all of you have good night, and I will see you on the next one.